Hi, my name is Samuele Gould. I'm specializing in biomechanics, specifically in silico biomechanics, so the modeling of the spine. And I've been working with the University of Bologna for my PhD. My PhD was focusing on simulating an experiment that they had performed here at the university to try and characterize the intervertebral joints. And that was towards the larger goal of creating patient-specific scoliotic models, which would be to try and help surgeons better perform the surgery. When I was at Sheffield University doing my master's, they opened a new course which was mechanical engineering with biomechanics, which was led by Professor Silico. And so I signed up for that. And there I had the opportunity to do some various bits of modelling, finite element modelling, looking at paediatric femurs. And from there, from some of the contacts, and they had some contacts here in Bologna, they said, look, there is this PhD that could be very interesting. And I had a look and it ticked a lot of the boxes I wanted. If you think about your elbow or your wrist, you can rotate it, but you can't sort of push it out or push it in. You straighten your entire arm. Whereas in the spine, you've got a little bit of movement in every single direction individually. And then on top of that, the joint has some mechanical properties. So it squashes a certain amount. In fact, if you measure yourself when you first wake up in the morning, you'll be slightly taller than when you go to bed at night because your spine is squashed. In some diseases, especially such as severe scoliosis, you have to have very invasive surgeries, which essentially require the surgeons to apply screws and use metal rods to try and straighten the spine. And this is just one example. The problem is that this is relied heavily on the surgeon's experience and their past knowledge, and due to the variety of techniques they have, also their own personal preferences as to how to treat and perform a particular correction. That, however, doesn't necessarily correspond to the optimal treatment for a specific patient. And so these models will be, hopefully in the future, be able to give the surgeon an opportunity to virtually perform a surgery to get an idea of if you can test out different methods and different techniques, whether or not it will be more successful. That's obviously not something you can do to a patient. You can't say, oh, can you come in tomorrow, I'm going to try something different. Investigating other topics of research, or maybe even just different methodologies. So a lot of the work I've done has been musculoskeletal modeling, but of course with a lot of new AI-based methods coming in or big data methods coming in, it'd be very interesting to apply these methods, but again, to the spine.